Hey folks! Thanks for tuning in to everything you need to know about COVID-19, the coronavirus. In the next few minutes, we will aim to tell you everything you need to know about this virus, from its background and origin, total number of cases, symptoms and prevention, and the impact it continues to have on us. We will even talk about some of the wonderful acts of generosity that have been witnessed globally due to the pandemic. On the 31st of December 2019, the World Health Organization was informed by the Chinese health authorities of a cluster of viral pneumonia cases in Wuhan, China. A month later, the WHO declared the outbreak a public health emergency of international concern, or PHEIC. By this time, the virus had spread to 19 countries, and there were over 7,800 cases. The first known case can be tracked back to the 1st of December 2019 in Wuhan, China. According to Chinese sources, most early cases in Wuhan were linked to a seafood wholesale market which also sold live animals, and one theory is that the virus came from one of these animals. On the 31st of January, 2 tourists from China became the first confirmed cases in Italy. By the 13th of March, the World Health Organization had declared Europe as an active center of the pandemic. By the 19th of March, Italy had overtaken China as the country with the most deaths. A week later, the United States took over China and Italy with the highest number of cases. Research indicated that the majority of COVID-19 cases in New York came from European travelers, not directly from China or any other Asian country. But after retesting of prior samples, it was found that the virus had been in the West for longer. A person in France was confirmed to have the virus on the 27th of December, and another person in the US had died from the virus on the 6th of February. As of the 11th of May 2020, more than 4.16 million cases have been reported in over 187 countries. 285,000 have died and more than 1.45 million have recovered. Governments and health departments around the world are reporting cases on a daily basis, but here's why you need to approach this information with caution. When you hear the total number of cases, remember that this only includes those that have been tested according to official protocols. As of the 29th of April 2020, countries that published their data on average only tested 1.4% of their population, and no single country has tested more than 14% of their population. That's right, less than 1 in 50 people have been tested on average, so there could be millions more out there with the virus. Even as early as January 23rd, it was estimated that 86% of COVID-19 infections had not been detected. Preliminary tests in Gangnet, Germany, New York City and the Netherlands showed a considerably high number of people who tested positive for antibodies, meaning that they had already had the virus and recovered from it. Information about the number of confirmed cases can be very misleading. Take these 2 examples from China. A study published on the 11th of April found that a relatively low proportion of the population under 20 had the virus. However, it wasn't clear whether it was because young people are less likely to get infected or simply less likely to develop serious symptoms and therefore seek medical attention and be tested. A retrospective cohort study, also from China, published just 2 weeks later, found that children were indeed just as likely to be infected as adults. Thankfully, most people who contract COVID-19 do recover. Sadly, a large number do not. The time between the onset of symptoms and death ranges between 6 and 41 days, and typically 14 days. By the 11th of May 2020, over 285,000 people have sadly died from COVID-19. Figures reported on the 5th of February in China show that 80% of deaths were recorded in those aged over 60, and 75% of the deceased had pre-existing health conditions such as cardiovascular disease or diabetes. The first confirmed COVID-19 death was in Wuhan on the 9th of January, and the first death outside of China occurred on the 1st of February in the Philippines. On the 14th of February, the New York Times reported a death in France, the first outside of Asia caused by the virus. Unfortunately, even the way in which the deaths are reported is not accurate. The published statistics generally refer to people who have died after testing positive according to official protocols. These numbers ignore those who had died without testing, either at home or in nursing homes. On the other hand, deaths of those with underlying health conditions may lead to overcounting. But when you compare the death statistics from all the causes versus the seasonal average, you will find an excess mortality in many countries. In New York City, the mortality rate has been a shocking 4 times higher than average, and twice as high in Paris. In many European countries, on average, there has been a 20 to 30% increase compared to average deaths. But again, these numbers may not just be due to COVID-19, and could also be partially attributed to strained healthcare systems globally, as well as bans on elective surgery in some places. As of the 11th of May, the death-to-case ratio globally is 6.8%, though this number varies by region. Symptoms of COVID-19 can be non-specific, and some infected people may even be asymptomatic, meaning they do carry the disease but do not display any symptoms. The two most common symptoms are fever, found in 88% of those infected, and a dry cough, found in 68% of people infected. Less common symptoms may include fatigue, phlegm, loss of sense of smell or taste, shortness of breath, muscle and joint pain, sore throat, headache, chills, vomiting, coughing out blood, and diarrhea. Approximately 1 in 5 people become seriously ill and have difficulty breathing. Emergency symptoms which require immediate attention include difficulty breathing, persistent chest pain or pressure, sudden confusion, difficulty waking, or a bluish face or lips. People are most infectious when they show symptoms, even if the symptoms are mild. However, they may even be infectious up to 2 days before the symptoms appear, known as pre-symptomatic transmission. Typically, people remain infectious for between 7 and 12 days, and an average of 2 weeks for severe cases. The disease spreads during close contact, often by small droplets produced during coughing, sneezing, or talking. During close contact, which is typically 1 to 2 meters or 3 to 6 feet, people catch the disease after breathing in contaminated droplets that were exhaled by infected people. These contaminated droplets also cause infection when they settle in the noses or mouths of people in close proximity. These contaminated droplets can even be infectious when they fall onto the floor or other surfaces, though this is less common. If people touch contaminated surfaces and then their eyes, nose or mouth with unwashed hands, it can lead to infection. On surfaces, the virus decreases over time, and this is not thought to be the main way it spreads. However, the virus can be detected for up to 4 hours on copper, 1 day on cardboard, or up to 3 days on plastic and stainless steel. It is possible that anyone can be carrying the disease without showing any symptoms, so prevention by way of maintaining good personal hygiene is very important. Wash your hands thoroughly and regularly. Avoid touching the eyes, nose or mouth. Coughing or sneezing directly into a tissue and putting these tissues in a waste container or bin immediately. Those that have the infection are advised to wear a surgical mask in public. Social distancing is also an important prevention technique and is even required by law in a lot of countries. Unfortunately, there are lots of misconceptions about preventing the infection. For example, to rinse the nose or gargle with mouthwash, both of which are not effective. Nor are disinfectant injections or exposure to UV light as suggested by President Trump in a press conference on the 23rd of April. Those who may have been exposed to someone with COVID-19 and those who have recently travelled to a country or region with widespread transmissions are advised to self-quarantine for 14 days from the time of the last possible exposure. The virus quickly changed the lives of many people around the world. 187 countries so far have reported at least one case of COVID-19. In Europe, many countries restricted free movement and set up border controls. Many governments around the world started containment measures such as quarantines and curfews, also referred to as lockdown, shelter-in-place orders, or stay-at-home orders. By the 26th of March, 1.7 billion people worldwide were in some form of lockdown. This has increased to 3.9 billion, more than half the world's population by the first week in April. Many countries imposed quarantines and entry bans on travellers, which has had a significant negative social and economic impact on the travel sector. The World Health Organization commended Chinese authorities on its handling of the virus, noting the contrast between the 2002 to 2004 SARS outbreak, which had led to accusations of secrecy. However, many criticized China for its handling of the COVID-19 situation and questioned the statistics published by the central government. The WHO themselves have been criticized for the delay in declaring the pandemic and public health emergency. Amid the panic, accusations continue to fly, with China being criticized by the UK and US of its handling on the situation. On the other hand, the Italian ambassador to the EU criticized the European Union's lack of solidarity, defending China and saying that only China had acted bilaterally. The impact to date has been significant. Politically, many legislative activities globally were suspended, and multiple politicians were isolated or even died due to the virus. Even some elections were postponed due to risk of the virus spreading. Approximately 73% of the world's student population, which is over 1.26 billion people, were impacted by closures of schools and universities. Other factors include supply shortages caused by an increased usage of equipment to fight the outbreak, as well as panic buying, which resulted in essentials such as food, bottled water, and toilet paper being cleared off shelves in grocery stores. Globally, factories and logistics operations are impacted. In the UK, price increases and shortages in illegal drugs was even noticed on the streets. This was attributed to the shortage of precursors used in the manufacturing of such drugs. The economic impact became evident very quickly. On the 27th of February, the Dow fell 1,191 points, its largest one-day drop since the financial crisis of 2007 to 2008. Millions lost their jobs globally due to the impact on the tourism, retail, and other key sectors. Oil prices faced a steep decline, and on the 20th of April, the price of West Texas Intermediate went negative and to a record low of -$37.63, as traders offloaded their holdings so as to not incur shortage costs. Culturally, the impact continues to be felt to this day. Museums, libraries, and performance venues across the world remain closed. The Holy Week observances in Rome, which marked the end of the season of Lent, were cancelled. Other religious bodies cancelled services and limited public gatherings. Saudi Arabia banned the entry of foreign pilgrims to holy sites in Mecca and Medina. This pandemic has caused the most significant disruption to sporting events since the Second World War. Most major sporting events have been cancelled or postponed, including the UEFA Champions League, Premier League, NHL season, and even the Summer Olympics. On the flip side, many regions experienced a drop in air pollution due to the drop in travel. In China, a 25% drop in carbon emissions was recorded due to the lockdown. Some Earth system scientists estimate that over 77,000 lives have been saved over the 2 months due to reduction in carbon and nitrogen oxide emissions. Unfortunately, since the outbreak, cases of xenophobia and racism have increased against people of Chinese and East Asian descent. In February, citizens of many countries, including Malaysia, New Zealand, Singapore, and Vietnam, lobbied to ban Chinese people from entering the country. In the UK and US, Chinese people and other Asians reported increasing levels of racist abuse and assault. President Trump even referred to the coronavirus as the Chinese virus, which critics deemed to be racist. Meanwhile, inside China, racism against non-Chinese residents increased, and foreigners were described as garbage. Due to misinformation that foreigners were spreading the virus inside China, some black people in China were even evicted from their homes by police and told to leave the country. Though China did later apologize for discriminatory practices such as exclusion of black people from restaurants, the accusations of such harassment continued. People from Italy were also subjected to suspicion and xenophobia as the virus became widespread in the country. In Paris, riots broke out due to police treatment of ethnic minorities during the coronavirus lockdown. The COVID-19 pandemic resulted in many conspiracy theories and misinformations about the origin, scale, prevention, and treatment of the disease. False information spread via social media, text message, and even the mass media, including state media of countries such as China and Russia. Some countries, such as Russia, were even accused of covert operations to create panic and distrust in other countries. In the US, even the president propagated misinformation, for example by suggesting that injecting disinfectants might help treat the virus. Some even claimed that the virus is a biological weapon with a patented vaccine, or a population control scheme, or even linked to 5G networks. There is no evidence to suggest that any of this is true. While the virus spread rapidly throughout the world, causing death and disruption, it brought some communities together, and we got to witness great acts of generosity by individuals and states. By the 5th of February, China declared that 21 countries, including Pakistan, Trinidad and Tobago, Egypt, and Iran, had sent aid. Bill and Melinda Gates announced a $100 million donation to the World Health Organization to fund vaccine research and treatment efforts and protect at-risk populations in Africa and South Asia. Once things settled in China, it started to aid other countries. China, Cuba, and Russia sent medical supplies to Italy. Jack Ma sent 1.1 million testing kits, 6 million masks, and 60,000 protective suits to Ethiopia. He later also donated generously to Panama. Though no one knows for sure how long COVID-19 will continue to haunt us, the WHO and the scientific community is of the opinion that the pandemic can be controlled, but the duration will vary by location. All infectious outbreaks do eventually plateau and then start to decline when the disease runs out of available hosts, but it's impossible to project when that will be. Unfortunately, it is even possible that the virus, because it transfers so easily between humans, could make a comeback every year, becoming a seasonal disease, though this depends on herd immunity and the extent of mutation. One thing is for sure, we will need to continue some form of physical distancing and social distancing until a vaccine is available, which could take 18 months or more. And that is everything you need to know about this pandemic. We hope you found this video useful. Remember to hit the like button and subscribe to our channel for lots of comprehensive and educational content being released regularly.